Earlier, I spoke with the man leading White House task force, Vice President Mike Pence. I want to talk to you about the strategy being deployed here. And I've been watching these briefings, so tell me if I have this right. You have this 15-day pause period where you're trying to slow down the virus, and it also gives us a window to surge these supplies to the hot zones to the hospital, get the money out to the American people, so when the economy eventually does open up, you can go on offense with this thing, get these drugs out, and get the vaccine out eventually to kill it. Is that about right?
Jesse, I think you described it well, although thanks to President Trump's decisive action going all the way back to January, we've had the opportunity to stand up a whole of government approach. Now has marshaled leadership at the state and local level and has engaged literally businesses and every American in our 15 days to slow the spread. But I think it's important for your viewers to know that when the president made the unprecedented decision to suspend all travel from China in January, and then suspended travel from Europe, the UK, and Ireland, and even before that began screening all passengers from Italy and South Korea, it bought our nation time to do exactly what you said, and that was stand up a national response. The president signed a declaration of emergency around the country. We put FEMA in the lead, and literally over the course of this week, we've seen testing dramatically expanding. Now more than 500,000 tests performed around the country. We're surging supplies, especially to those areas of New York, New Jersey, California, Washington State, and parts of Louisiana where the coronavirus has spread the most. But the fact that the president acted early and the fact that tens of millions of Americans have been putting the president's coronavirus guidelines for America into effect, we truly believe that we have significantly reduced the spread of the coronavirus and we'll continue to make the recommendations and surge the resources to bring a full American response.
When the president did make the bold decision to slap the travel bans on, were there people in that orbit around him that were saying, no, 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 you don't have to do that now, maybe a little wait for a second?
Well, let me say the president listened to the healthcare advisors, and I was literally sitting next to the Resolute desk in the Oval Office when the decision about closing all travel from China was presented, and President Trump made that decision without hesitation.
Okay.
And he has every step of the way. He has put the health and safety of America first. But the really inspiring thing is that with the president's decisive actions, with the extraordinary efforts across the broad sweep, not just of the federal government, but I mean to say, this president has formed a partnership with every governor in America, organized our response through FEMA, because, you know, Jesse, you understand that when it comes to health crises in our country, the response are locally executed, those courageous healthcare workers and oftentimes law enforcement supporting them. And it is a state-managed, federally supported mission. And the president's been driving that with consistent leadership. And the legislation passed by the Congress this week, the third bill that the president was able to secure, is speeding resources to American families, help for people employed by and who own small businesses. It's going to strengthen our economy across the board, support our states and our hospitals and our healthcare workers. But what President Trump has made clear from early on is he would not hesitate to take the action necessary to protect the people of this country from the spread and the threat of the coronavirus. And we've put particular emphasis, if I can say, Jesse, on the most vulnerable.
Right.
You know, the truth is most Americans who even contract the coronavirus will actually have mild symptoms or flu-like symptoms, and they'll fully recover. But for a very small portion of Americans who contract this disease, particularly seniors with serious underlying health conditions or anyone with an immunodeficiency. The threat of the coronavirus is very real, and it's the reason why throughout the 15 days from early on when we raised the guidelines for every nursing home in America and began to do aggressive enforcement with long-term care facilities, we're going to protect our vulnerable Americans. But in the midst of doing all of that, as the President said, his desire is to put America back to work, is to open our country up as soon as we can responsibly do that. And the team this week has been bringing those recommendations to him.
So you, leading the task force, are looking at this recommendation that you're going to deliver to the President within the next week or so. It's a very tough decision, maybe even tougher than slapping the travel ban on China, because there's risks. If he opens the economy up too soon, there's a risk. If he doesn't open it up soon enough, there's another risk. What are you specifically looking at and basing your decision on, and then formulating a recommendation to the President on?
Well, it's the right question, Jesse. What I can tell you is, short answer, we're following the data. I mean, with the public-private partnership that the President secured with massive commercial labs around the country, we're literally doing tens of thousands of tests a day, and we've gotten a great deal more understanding about where people have contracted the coronavirus, who's recovered, who's most at risk, and the regions of the country most impacted. And so while the President has said that he'd like to open the country up in weeks, not months, we're going to be bringing that data forward to him. The advice of not the best healthcare experts in the country, the best in the world are working on our task force, and ultimately the President will make a decision that he believes is in the best interest of all of the American people.
There is a lot of data out there, and people get it from the U.S. media. Is there specific statistics that you think maybe people should not be focusing on or should be focusing on? Is it the mortality rate? Is it the number of people infected? Is it the percentage of people who get tested that don't have the virus? What do you think people should and shouldn't be focusing on when they hear numbers?
Well, first and foremost, it speaks to the compassion of the American people, that our hearts go out to any American family that's lost a loved one from the coronavirus. And American people are right to focus there. But to your point, Jesse, the number that you don't see recited on screens on a regular basis is how many people have been tested versus how many people have contracted the disease. People can go and look for that data on virtually any network, including this one, on a regular basis. But literally, because of the partnership that the President forged to create an all-new system of testing that really replaced a system that was never designed to do the massive surveillance testing that we're able to do today, we have a much better understanding. And apart from some areas of the country where we've seen a higher incidence of the coronavirus, areas like the New York City metropolitan area, the average is that for everyone that is tested, roughly 10% of Americans test positive for the coronavirus. And I believe that would be an encouragement to people to understand that while they may have symptoms, and they're certainly more than entitled to have a coronavirus test, that still the data is showing that whether it's 8 out of 10 or 9 out of 10, that number of Americans, the vast majority of Americans even that have been tested for the coronavirus, have not tested positive. And that's a number that I think should be an encouragement to people, but also factor into their understanding about the scope of the coronavirus in our country.
That's a great number. And before I let you go, I just have one thing you might want to address with the task force. If the task force was to tell every American, if you guys could all stay inside for 1 week, we would save the 2020 football season. I'm telling you, the whole South would be locking up in their own bedrooms. You don't understand. They want their football. If you could just tell them to stay inside, to save football, that would do a lot of good.
Well, Jesse, thanks for the recommendation. And I'll tell you, look, I think President Trump has made it clear. we want to open our country up as soon as we can responsibly do that. But you know, my last word tonight to your millions of viewers around the country is we can hasten the day where we can reopen our country if the American people will put into practice the president's 15 days to slow the spread, avoiding groups of more than 10, not eating in restaurants, avoiding unnecessary travel, washing your hands, looking after members of your family, staying home if you're sick. People have been doing this all over the country over the last 2 weeks, and all our health experts are convinced that it's had a material effect on impacting in a positive way the spread of the coronavirus. We think we've significantly reduced the number of Americans that have been exposed, but as the American people put these guidelines that the president issued now the better part of 2 weeks ago into practice, we know that we can slow the spread, we can protect our most vulnerable, and we will heal our land.
Thank you very much, Mr. Vice President. We appreciate it.
Thank you, Jesse.